Hi guys, this is Dr. Arya with Arya Foot and Ankle. Wanted to talk to you today about plantar fasciitis. So what is plantar fasciitis? Today we're going to cover a few things. Plantar fasciitis, we're going to talk about what it is, who gets it, how to treat it, and how it can be prevented. Plantar fasciitis is inflammation of the plantar fascia band. About 83% of adults 25 to 65 will get this. And so it's very important that we understand what the plantar fascia band is. So the plantar fascia band is like a rope and it connects the heel to the toes. So every time your heel hits the ground and your arch activates, it is pulling the rope across the bottom of your foot. So the plantar fascia band is a stabilizer for your foot with every activity, whether it's walking across a floor barefoot or you're in a great pair of boots. Your plantar fascia band is always being activated. You may have heard of a heel spur before. In this picture, you can see an x-ray. The x-ray shows a projection off the heel bone that is kind of sharp. It's right here. I don't know if you can see my mouse going across it. That sharp area is the insertion point of the plantar fascia band. An insertion point is where the rope of the plantar fascia band is nailed into that area. And as the rope tugs and pulls, it's actually pulling so hard, it's pulling a little bit of the bone with it. And that's what creates that hook shape. So when people talk about heel spur syndrome, they're really talking about plantar fasciitis. And people with advanced plantar fasciitis will have that kind of spurring on the bottom of the heel. So to understand the anatomy of the plantar fascia band, you need to understand the Achilles tendon, the calf, and the hamstring muscles. All three of these are very important when regarding the plantar fascia band. So the hamstring is up at the top of the back of the femur, so the back of the leg, right off where the buttocks are. The calf is right below the knee, and then the Achilles tendon is the continuation of the calf muscle, and that blends into the plantar fascia band. So here you can see in red the hamstring, the calf muscle, the Achilles tendon, and the plantar fascia band from top to bottom. So when you're stretching your hamstring, you're stretching your calf. And if you're stretching your calf, you're stretching your Achilles tendon. If you're stretching the Achilles tendon, you're stretching the plantar fascia band. So it's really important that you stretch the whole posterior complex in order to get a great elongated stretch for the plantar fascia band itself. So what does plantar fasciitis feel like? What are some symptoms people have? People describe it as, number one, pain with first steps in the morning. So people describe it as a stabbing pain, a shooting pain that kind of warms up after the first steps in the morning. People have experienced pain when walking barefoot, noticeable discomfort in unsupportive shoe gear. A lot of times flip-flops is the culprit. I see a lot of people in the summer. And fatigue by the end of the day. This is because the plantar fascia band just gets tired. It's working so hard to support people. People also describe tiredness and feeling heavy in the legs. So plantar fasciitis, anybody can get it, whether they're active or inactive people, and we'll go through why. People that are active, their plantar fascia band, that mobile adapter, that rope at the bottom is working really hard, and so it can get fatigued or tired. For runners that have that tight posterior chain complex, that chain with the hamstrings, calf, and Achilles, and their hip flexors tend to be really tight. When things get tight, they shorten, and because of that, they really cause a lot of pulling at the band, and the rope itself of the plantar fascia band starts to unwind or untendril, and that unwinding can be very painful. It's the itis in plantar fasciitis. For people that are not active, some of the same things tend to tighten up if you're sitting at a desk all day. It's really important to stretch before doing activities, but also by the end of the day to mitigate this problem. So how do we treat plantar fasciitis? Interestingly enough, only 5% of people really need surgery. Now there's been different statistics over time, but this is a recent one. This is from 2016 from the American Academy of Orthopedic Surgeons. And they say that 95% of cases of plantar fasciitis can be managed conservatively or without surgery. That being said, a lot of times in order to make plantar fasciitis better, it's going to take anywhere from 12 to 16 weeks to start to notice that improve, because plantar fasciitis does not happen overnight. It is a long-term issue, and to make it better, it does take time. Ways that we treat plantar fasciitis, the two mainstay treatments are stretching and good shoe gear. So inserts are something stretching. You can see this person is stretching with a TheraBand and pulling back on the toes. What that does is activates the calf muscle, the hamstring, and the Achilles, which stretches the plantar fascia band, and definitely shoe gear, which we all know can make a big difference. So in the office, what to expect at your appointment. So first thing when you come in, we'll usually get an x-ray. We'll also sometimes do an ultrasound. An ultrasound is a way to see into the deep connective tissue. It's a lot different than an x-ray in that you're seeing the soft tissue versus the bone. The next thing we'll do is do a clinical exam, and I love to do a gait analysis, see how you're walking with and without shoes, and how that might be incorporating into prevention of the plantar fasciitis. So in-office treatments for plantar fasciitis, you can see all these options here. Some of the most popular ones that I do are steroid injections and custom orthotics. Steroid injections are very helpful. We try not to do more than 3 a year, and we don't always have to do steroid injections, so I never start there, but they can be really helpful to decrease inflammation. So that's always something to consider. And custom orthotics, that is a hand-molded cast. You'll see a video coming up where I show how I make the custom orthotics, but that's something that goes into your shoe directly, and it's made for your foot. Also, a night splint that's on this list, that's really helpful. That's a durable medical equipment device, and it basically holds your toes back towards your nose, stretching the back of the calf muscle and the Achilles all night. So all night you get a sustained stretch of the plantar fascia band, and that really helps with those first steps in the morning. In my office, I always give a custom stretching protocol. So that's something that we work on together and come up with some great stretching exercises to decrease the symptoms associated with plantar fasciitis. Surgical treatment for plantar fasciitis, there are basically two things, and if you remember the x-ray that I showed with the kind of hook-shaped projection, both of these procedures usually means shaving off that bump and doing it either opened, where you open it up directly and you take a little slice of the plantar fascia band, or closed, which is endoscopic. You use like a light optics in order to see underneath the skin through 2 stab incisions, and you make a small cut in the plantar fascia band. This effectively releases the plantar fascia band so that there's no more pulling and tugging at that rope. It's just cut all together, and it heals really well. So how do you prevent plantar fasciitis from coming back? Stretching, like we said, shoes and orthotics, and just being consistent with the daily routine. One of the biggest things I see is patients come in, plantar fasciitis gets better in 4 to 6 weeks, and then I see them back 3 months later with the same problem, sometimes even worse. That's why consistency and daily stretching and wearing good shoes is really important. So that's it for today. If you have any questions, you can always visit us at aryafoothandankle.com to schedule an appointment, and we hope to see you soon. Thanks.